Good evening. Welcome to my show, Lifestyle with Dr. Mobi. This is Dr. Mobi. Welcome you all over the world. And today we're going to discuss a special update and salute to frontliners, healthcare workers. But before we do that, I just want to remind everybody that this pandemic is actually going to be a story of teamwork and at every level. I count people cleaning bed in the hospital, getting groceries, making sure the rooms are clean, make sure everybody is getting food, and keeping every linen clean in the hospital, as well as making sure we are working on getting PPE for every healthcare providers. And whenever we'll write these stories, will always be frontline healthcare workers, which really dedicated all their life and effort for this pandemic. And I am pretty sure that we're going to defeat this with all the teamwork we had. So give the numbers update. I think we are in US, we have the highest number so far, but luckily the death rate is 4%, which is we're still working hard to get that number under control. These are the total numbers as you can see, and in US is 699, pretty close to 700,000. And in our county here in Virginia, Fairfax is 1,200 cases with 21 deaths. Prince William County 582, 14 cases of deaths, and other Loudoun County 344. But I think this does not tell the story. The main story will always be that it's a teamwork, and at every level, I have seen dedication, and it makes all of us so proud of this. So today we have a great therapist, well recognized for his service, a close friend of mine, Atul Phillips, and he's gonna share his thoughts and his experience with us. Welcome to our show, Atul.
Thank you, Dr. Mobi. Nice to see you. It's been a challenge, but we're working forward. We're making progress. We're trying to take care of all our patients in the hospital. I've been doing this for about 14 years. Work as a respiratory therapist. I worked at several hospitals, one local here in Inova, and also Centera Hospital, well-known hospitals. But no one in our team or doctors have seen anything like this. So, but we're all fighting this together, and hopefully we'll come out of this soon.
Okay, well, we salute your service as well as your dedication.
Thank
I
you.
don't think anybody has words for that. Tell us your routine. What is your normal routine? I know it's.
So it's a normal routine. It's completely changed. I mean, like normally we would not see as many intubations as we see on a daily basis. On an average, we're seeing at least on a daily basis, I can tell you we're seeing about 2 to 3 intubations in within like a couple of hours. So it's we have a whole team set up as far as my job goes. I'm the one who manages the ventilators. I have a few team members under me that we take care of the patients. We manage the vents. We help the anesthesia team to intubate. We have a whole protocol we're working on that. We work with that protocol and try to get everybody, all the staff members safely into the patient's room. We make sure that no one is exposed to this when we're intubating the patients. And then when they are intubated, we still take full precautions, and then we manage their ventilators. So we've taken it to the next level. Like we are doing, you're proning people means like normally how you would be laying on your back. Instead of laying on your back, you're actually laying on your chest. So that helps oxygenation. We do that. We also start nitric oxide, which is it's shown that the replication of the virus slows down with nitric. So we do nitric oxide too. So it's work in progress, but seems like we've got a control over it, and we've actually gotten a few patients discharged.
That's a very great news. Also, I want to ask you, tell me, for audience, we are both in medical field, but for common people to understand, these complications with respiratory failure, especially when patient would normally go for, this ventilator intubation, just for common people to
Yeah.
understand.
So basically, what we see normally is, in the hospital setting, I'm saying we see people on normal oxygen that goes in your nose, just a nasal cannula, and then eventually their symptoms are getting worse. When they come in the hospital, it's shortness of breath. They can't seem to catch their breath.
Mhm.
Their oxygenation drops. Like usually, your saturations would be anywhere from, for a normal person would be anywhere from 90% and above. But in these cases, we're seeing low saturations, and these patients have no reserve. Like as soon as they're
Mhm.
doing small stuff, they're moving around and stuff, they drop their oxygenation, and they drop it fast. So we have to act fast. We put them on like something higher, like a non-rebreather, and then as they're getting worse, we monitor them, and then worst case scenario is the intubation.
Okay.
Intubation meaning we put a breathing tube in them and then support them through the ventilator, like mechanical ventilation. So that's the worst case scenario.
Okay, just for common people to understand, to make ventilator and respiratory assistant devices, all these actually are helping your own breathing. So basically, people have hard time getting the oxygen and getting rid of the carbon dioxide. So then their respiratory rate. So normally, me and Atul, we are talking. As you can see, we're not breathing fast, but somebody who has a respiratory failure or respiratory problem, they will be breathing like really fast. Their rate will be really fast, and their oxygen, which we hook up, will tell us that is below 90 or even less.
Right,
And for some reason, it seems to affect a lot of lungs very quickly,
right.
and then they go downhill very quickly, unfortunately. And still they are studying why that's happening, but that's one of the sign. With people, we tell people, if you're getting short of breath with fever, you better get checked. Don't ignore it, because you can go downhill pretty quickly. And that's what is your experience, is
Yeah,
that?
and that's what we're seeing, like the spike in temperature, the shortness of breath. Just they can't, like how you and me are talking normal sentences. They can't even
Mhm.
talk in full sentences. So they go down the hill pretty fast. So we have to act fast accordingly.
And what's your experience so far? Did you see more men here in
I am
Virginia?
actually seeing the CDC also said this. We were also thinking like people with asthma are more prone to this, but apparently CDC is saying, and we've noticed this too, it seems to be people who are more on the obese side.
Okay.
Seems to be people with, we're seeing more people in their, I would want to say like 60 plus. So
Mhm.
age and obesity seems to be a big factor.
Mhm.
Also underlying diseases like COPD, or you got pulmonary fibrosis or something like that. That seems to be some of the diseases that people are coming with COVID.
Okay.
Yeah.
And is also, you can also educate us that why the intubation for COVID patient is harder than in normal person.
It's hard to, because their lungs get so stiff. It's like COVID is kind of like how you would treat a patient with pneumonia.
Mhm.
In worst case scenario, it's like ARDS. So their lungs they get really stiff. So it's hard to ventilate them.
Mhm.
It's hard to keep up their oxygenations. So because your lungs are stiff and you're not able to move, it's filled with gunk basically. So you cannot move the air in and out. So it's hard to ventilate them and breathe for them even through the ventilator.
Okay. And for everybody to understand, lung is like a very delicate sponge tissue, and it has great. You can inflate, deflate very easily.
Right.
But like he's saying, with ARDS, with these infection, they are so stiff. They are so hard to even oxygenate,
Yeah.
uh, and they put a lot of pressure to keep them open, and that's one of the treatment they use, and they push a lot of air and oxygen, especially oxygen, to keep the saturation good. But there is a lot of problem with oxygenation, and they have to position them reverse. Normally they would be okay on the back, but for these patients we are putting them on their belly and prone position.
Right.
So that, what is your experience with that? Are there, you seeing more benefit with that?
With prone, actually, we're even proning people just on even on nasal cannula or like a high flow. So
Mhm.
we're starting the prone process early on because I mean, normally we would think that most of our lungs are in the front, but actually most of your lungs are in the back. So
Mhm.
when you put them on their belly, it's easier for you to breathe. It's easier for you to oxygenate. So yeah, proning has shown better results. Like it has, I mean, it's a step before intubation that we're try not to intubate these people. So it does definitely help.
Okay, tell me, I know you have, seen a lot of cases which unfortunately go worse. What is the hardest thing about, beside making sure you don't catch infection, which is big concern, right? So,
Yes, absolutely. It is the hardest part. I think at this point, we've been lucky enough with our hospital that we have enough PPE. Everyone knows PPE, what PPE is now, but we have enough of that. And then the hardest part is just to catch them early on, not have them where it's already too late
Mhm.
and where the patient is gonna go in a respiratory failure. So we try to avoid that respiratory arrest because that leads to more problems and that could lead into cardiac arrest. So we try to catch them early on.
Mhm.
We have a special team going that we try to just assess all our patients in the hospital and not let them fall through the cracks. So that's been our priority, and that's been a little bit tough to do because we are seeing a big influx of patients.
Okay. And also, if you want to tell us a little bit about, has been there any more cases where, patients didn't get better and they had to say goodbye to their families, and it's been, I'm sure, toughest for all of
Yeah, unfortunately, there has been some cases like that.
them.
And but uh, for what I've seen, it's mainly been patients that are elderly. I have not seen anything bad happen to our younger generation or even mid-aged people. They seem to recover, even though we have to put them. Our hospital actually does ECMO too.
Okay.
So we do ECMO. So we place a few people on ECMO also, but it's mainly the older folks I've seen. It's
Okay.
tragic.
And what treatment beside, have you seen any luck with the medications or no?
I've spoken to like many physicians myself. They're saying it's all basically trial and error at this point.
Okay.
We did go with nitric a lot. Nitric oxide, it's a vasodilator. It seemed to slow the progression of the virus, but that's not even 100%. We're just trying to support the other systems, support the lungs, so your body can do its own thing and heal.
Okay, well, it's been a pleasure talking to you, and for audience to learn and to how hard it is for all of us, in healthcare, and to make sure, we are safe, our family. I'm sure it's very hard for your family too,
Yeah,
to make sure that you're safe and the
right.
whole family is under a lot of tension from that. So we keep in prayers, but and make sure you have a safe.
Thank you.
Rest of the treatment, um, all these months or days, whatever we have to face. But I think very important for audience to learn is make sure protect yourself, make sure keep your hands clean, make sure keep your social distance, so physical distance actually more, I would say, 6 feet, and don't go out unless you have to.
Right.
And I know it's been really hard, but staying home really helped actually.
It does. It does.
And the other thing is making sure that healthcare providers are getting all PPEs and all these, and they are doing on front line excellent job, and we are with all of them. Also, I think great thing for a lot of people ask me, and I say, what we can do is make sure we pay attention to our health. Make sure if you are diabetic, make sure your sugars are under good control. Don't let them go out, and eat healthy. Make sure keep an eye on your diet. Exercise do at home. You don't need to go to gym. You can do some walking. Make sure you are not sitting. Make sure you are taking care of your health. It's always important. Lifestyle does change, but changes are hard, but we can make it. We can do it together. And, that's the best thing is that we have this COVID-19 under great control and
Yes.
making sure, the healthcare providers, they do perfectly their job. And I think, thank you once again, Atul. It was a pleasure seeing you again, and I know it's recently you had your birthday too. Happy birthday.
Oh, thank you, Dr. Fatal.
Okay, okay, you take care. Okay,
All
okay,
right, thank you, sir. Thank you for having me.
okay, take
Okay.
care, take
Bye.
care. Thank you.